All right, welcome to the Certified Revenue Cycle Representative Assessment Preparation. This will be the last course that you will take in your preparation for the CRCR exam. The recordings are available. They can be found on the chapter's YouTube channel, and there will be a survey that'll be sent out in the next 48 hours. If you could please take the time to fill that out, it would be very helpful for us to determine how we want to structure these kind of trainings in the future. The content today is going to be a series of questions. When they pop up, we will give you a little bit of time to read through the question as well as the options. And then if you would like to put your answer in the chat function, that way you can see, how you've done as we go through it. And then so we'll wait a little bit and then we will share the answers. Okay, so we will go ahead and get started. First question, what happens during the post-service stage? Go ahead and put your answers in the chat and we'll give it about 30 seconds before we let you know what the answer is.
It's not allowing us to select the answer.
I think you just, I think you just put it in the chat so that somebody put 3 in there.
Thanks.
Yeah, so there's not any actual polling questions for this one. All right, so the answer is number 3, final coding of all services, preparation of claims, payment processing, and balance billing and resolution. So the post-service stage is the third and final major segment of the revenue cycle. This includes account activities that occur after the patient is discharged until the account reaches a 0 balance. Which item is not best practice for patient-friendly billing? And the answer is number 2, report to healthcare plans when patient account is transferred to collection agency. Next question. Which option is not a main HFMA healthcare dollars and cents revenue cycle initiative? And the answer here is number 2, which is process compliance. The other 3 are part of it. Next question. What is the objective of the HCAPS initiative? Okay, and the answer here is number 1, to provide a standardized method for evaluating patients' perspective on hospital care. Which is not a department that supports and collaborates with the revenue cycle? And the answer here is assisted living, number 3. So assisted living is non-acute care usually a residential service, typically part of the continuum of care for a select group of patients. The other 3 are all need coordination with revenue cycle. Next question, which option is not a continuum of care provider? And the answer here is number 2, which is health plan contracting. Which of the following are not essential elements of a compliance program? And just a hint on this one, there are 2 answers. Okay, so the answer here is number 3 and number 5. So automatic dismissal of any employee excluded from participation in the federal healthcare program, and designation of a compliance officer employed within the billing department. You need a compliance officer, but it doesn't have to be or it shouldn't actually be in the billing department. What is believed to be the backbone of the compliance program? Okay, and the answer here is number 3, code of conduct. So if the code of conduct is implemented effectively and enhanced as needed, it can reduce weaknesses by helping employees and agents understand their roles and responsibilities. Next question. What is the transaction code set for referral certification and authorization? And the answer here is number 3, the 278. The 834 is for enrollment and disenrollment in a health plan. The 820 is the health plan premium payment. And 276 is the health claim status request, and 277 is the response. Identify which option is not a work plan task mentioned in this course. So the correct answer here is the first one, reconciliation of outlier payments. So the reconciliation of outlier payments to enable Medicare contractors to perform final settlement of the hospital-associated cost reports. In order to promote the use of correct coding methods, CMS developed what? Okay, so the answer is somewhat in the question, and that's D, the correct coding initiative, CCI. So the purpose of the CCI is to ensure that the most comprehensive groups of codes, rather than component parts, are billed. What is not an ethics violation example? And the answer is number 2, duplicate billing. All others are examples of ethics violations. Additional examples are theft of property, falsifying records to boost reimbursement, and privacy violations. What do business/organization ethics represent? And the answer here is number 2, principles and standards by which organizations operate. So in healthcare, both clinical and financial personnel must be fully aware and engaged in the laws and regulations that govern their work. Business or organizational ethics are relevant to the conduct of individuals within an organization. What does the hospital value-based purchasing provide? And the answer is number 3, rewards acute care hospitals with incentive programs based on how closely best clinical practices are followed. The physician quality reporting is number 1, hospital readmission reduction program is number 2, and the Affordable Care Act is number 4. What is the intended outcome of collaborations made through an ACO delivery system? And the answer here is number 1, to ensure appropriateness of care, elimination of duplicate services, and prevention of medical errors for a population of patients. By meeting established benchmarks for quality and efficiency, participating organizations may receive a share of the savings generated by reducing duplicative services, improving productivity, minimizing paperwork, and other cost efficiencies. What is not a value that is used to estimate net receivables? So the answer here is number 2, charity care. Cash is an accounting method that records revenue when payments are received. To estimate net receivables, the following reserves are estimated and deducted from gross receivables: contractuals, self-pay adjustments, bad debt, other allowances. What is an example of a non-acute patient type? And the answer here is number 3, skilled nursing. Observation is an acute unscheduled patient type. Routine diagnostic testing is acute scheduled is acute. And then recurring serious patients are also acute. Skilled nursing is non-acute, and patients are admitted into SNFs when they no longer meet the criteria of acute care, but still need an inpatient level of skilled nursing or rehab services. How many days must a patient be inpatient for Medicare to pay for the SNF or skilled nursing facility? And the answer here is 3, the third answer. What is the intent of the patient reminder after scheduling? And the answer here is number 3, to provide the patient with a written list of the patient's responsibilities before their appointment. Which exam requires a physician order? And the answer here is number 2, CT scan. So tests and services can only be provided with a valid physician order. The few exceptions are requests from Medicare beneficiaries for flu vaccines, pneumonia vaccines, or screening mammography. Name the guideline that Medicare established to determine which diagnosis, signs, or symptoms are payable. And the answer is number 2, local coverage determination. Medicare and other health plans will only pay for tests and services that are deemed to be reasonable and necessary. Medicare has established guidelines called local coverage determinations and national coverage determinations. What is the purpose of insurance verification? And the answer here is number 4, to ensure accuracy of the health plan information. So during the process, coverage issues are identified and communicated to the patient. Insurance verification sets the stage for completion of financial education and account resolution based on deductibles, coinsurance, and other coverage limitations. When is Medicare the secondary payer? The correct answer here is number 2. Patient has Medicare through end-stage renal disease, has an employer group health plan, and is within the 30-month coordination period. Once they have met the 30-month coordination period, then Medicare is primary. If the patient has an employer group health plan, then it must have more than 20 employees. And if they have it via disability, then it must have more than 100 employees. Always keeping it complicated. Which health plan covers uniform services members? Okay, and the answer here is number 2, TRICARE, which is formerly known as Champus. It is the health insurance carrier for active duty service members and their families, retired service members and their families, members of the National Guard and their families, and the survivors and others who are eligible. The plans include TRICARE Prime, TRICARE Standard and Extra, and TRICARE for Life. So which Medicare plan offers drug coverage? And the answer here is number 4, Medicare Part D. So your Medicare Part A provides benefits coverage for inpatient hospital services, skilled nursing care, and home health. Medicare Part B benefits are available for outpatient and professional services. And then, Medicare Part C is your Medicare Advantage, and then Part D is the drug coverage. Next question. How many lifetime reserve days does a Medicare patient have? And the answer here is number 2, 60. So after the 60 full and 30 coinsurance days are used, the beneficiary may opt to use 60 lifetime reserve days. Again, OPT to use, so they have to be asked. The daily out-of-pocket for each lifetime reserve day is 50% of the current deductible amount. The days are used once in a lifetime and never renew. What is the timely filing for Medicare? And the answer here is number 3, 1 year. What is not a category that meets Medicaid requirements for coverage? So the answer here is number 3, unemployed. So to be eligible, an individual must meet income and asset requirements and fall into one of the following major categories. So children, pregnant women, adults and families with dependent children, individuals with disabilities, and the elderly. Which contract type divides outpatient services into procedural groups for reimbursement? And the answer is number 3, ambulatory payment classification. So DRGs are for inpatients. Case rates establish a single payment for all services provided to the patient. And then package pricing provides a single bundled payment to hospitals and physicians for things like cosmetic surgery and maternity services. Which is a component of the CMS price transparency rule? All right, so the answer here is number 2, provide a comprehensive machine readable file with 5 standard charges. Actually, that one's wrong too. Hang on. It's number 3 because it's more than 5 standard charges. So the mandate has 2 primary requirements: comprehensive machine readable file and a consumer-friendly shoppable services. So for hospitals, posting their charge masters have been around for some time now. The contract rates, minimum and max, are the new part. So how many shoppable services are mandated by CMS? So this one's actually a kind of a trick question. So the answer here is number 4, 70. So although hospitals have to put a total of 300 shoppable services, only 70 specific CPT codes services are mandated by CMS. The other 230 is based on volume at that specific provider. It's a little bit tricky. What is the first step you should do in financial counseling? And the answer here is number 3, greet the patient, and give your name. So what is not a best practice in patient financial communications? Okay, and the answer here, number 2, delay care in the emergency room until financial obligations are discussed. So as everybody knows, EMTALA strictly restricts the provider from delaying care until financial obligations are discussed. Once the financial responsibility has been identified, the financial counselor initiates a conversation with the patient to explain health plan benefits, the price determined, and also helps the patient identify an account balance resolution. Which physician writes the admission order and is in charge of the patient's care for a period of time? So the answer here is number 3, the attending. So primary care is usually a family practitioner, OBGYN, a pediatrician, or a general internist. The referring is typically a primary care physician who refers a patient to a specialist for care that's beyond their scope. The attending is the physician who wrote the order for service and is the physician in charge of the patient's care for a specific period of time, also referred to as the admitting physician. So attending physicians can also bring in specialists to consult for specific areas of concern, which is the consulting. What is not a condition of admission form? And the answer here is number 3, the privacy notice. So the conditions of admission include the medical and surgical consent, the release of information, the financial agreement, and the assignment of benefits. The privacy rule, which was issued to implement the requirements of the HIPAA Act of 1996, it addresses the use and disclosure of an individual's health information. If the patient will not stay more than 2 nights, what is the right admission status? And the answer here is number 3, observation. So refer to the 2-day rule for more information on this. Which case management review is done during service? All right, the answer here is number 2, concurrent review. So the pre-certification or prospective review happens before service, concurrent review happens during service, and then retrospective review happens after service. So which modifiers are used to designate an anatomical location? And the answer here is number 2, level 2. Modifiers are typically assigned via the CDM process, but some can be assigned via coding. Level 1 can discuss common scenarios such as bilateral or multiple procedures. Level 2 will designate a right or left side or part of the eyelid or hand or artery. Level 3 modifiers differ significantly because they are assigned by each MAC, such as cosmetic surgery, not commonly covered, or an FDA approved drug. What information is not part of an EHR? The answer is number 2, past payment history. So an electronic health record, or EHR, is a digital version of a patient's paper chart or medical record. EHRs are real-time, patient-centered records that make information available instantly and securely to authorized users. While an EHR does contain the medical and treatment histories of patients, it is built to go beyond standard clinical data and can be inclusive of a broader view of a patient's care. It can also include things like immunization dates, allergies, radiology images, and laboratory and test results. The EHR is the connection of the clinical documentation process to the coding and charge process that supports claim generation. What billing format is used to electronically submit professional claims? So the electronic version of the CMS 1500 is called the 837P. The electronic version of the UB04 is called the 837I. What is the definition of a clean claim? So number 2, a claim that is sent to a payer, either electronically or on paper, that has no defect in proprietary or particular circumstance requiring special treatment that prevents prompt payment. So it's defined as a claim that is sent to a payer, either electronically or on paper, that can be processed. Providers should attempt to receive the highest clean claim rate, best practice being 95 to 99% of all claims require no staff touches, by putting robust edits in both their HIS system and their clearinghouse. Which code provides additional information pertaining to the period being billed on the claim? So it's number 2, occurrence codes can provide additional information pertaining to the period being billed on a claim. Again, if employee related occurrence code 04 with the specific date of an accident would be listed. Condition codes are used by the provider to describe the conditions or events that apply to the period being billed on the claim. For example, if it's employed related, then code 02 should be listed. Just as the name implied, an occurrence span code would be used for an event that spans a period of time if a portion of a patient's inpatient stay was considered not covered due to the level of care. A span code of 74 would be entered from the specific to and from date. Value codes and dollar amounts represent data of a monetary nature. A common code is 01, which denotes the most common semi-private room rate in a hospital. Which is not a factor to meet criteria for skilled nursing facility coverage. So the answer here is number 2, needs care for at least 100 days. Care in a SNF is covered if all of the following 4 factors are met. Requires skilled nursing services or skilled rehab services. Requires skilled services on a daily basis. Daily skilled services can only be provided on an inpatient basis. Ancillary services are available if needed on an emergency basis. A patient is eligible for 100 days of care in a benefit period. As long as a patient is entitled to Part A, there is no limit to the number of benefit periods they may have. A benefit period is synonymous with spell of illness. What is the intent of the Medicare Bundled Payment Initiative? Number 3, align incentives between hospitals, physicians, and non-physician providers in order to better coordinate patient care. The Medicare Bundled Payments Initiative is an example, like a good example would be the comprehensive care for joint replacement. Package pricing is a payment system in which a lump sum or bundled payment is negotiated between the health plan for some or all of the services typically associated with the procedure, including hospital, surgical, anesthesia, and radiology. This is typically used in cosmetic procedures and sterilization. What is the first thing you should do in the cash posting daily reconciliation process? And the answer here is number 3, obtain total of all payments. Cash handling opens the potential for fraudulent activities and requires controls to ensure the safeguarding of cash flow. These controls include the separation of cash handling procedures, whereby the same person who opens and endorses the checks is not responsible for the deposit, the establishment of internal audits outside the involved department, routine use of outside auditors to track cash flow, the routine reconciliation of daily cash against deposits, postings, and write-offs, the use of multiple levels of authorization for refund checks, write-offs, and disbursements. What is a network of money movement available to banks through the Federal Reserve System? The answer here is electronic fund transfer. So this is from payer to payee through the banking system. It is considered the fastest way to move money because it is possible to transfer funds between banks on the same day. This is a network of money movement available to banks through the Federal Reserve System. What is not a reason for credit balances? And the answer is insurance takebacks. So allowance issues usually occur when there is a payer with multiple health plans and a patient was registered with the incorrect plan type. Large charge credits commonly originates from service departments that do not process charges within the organization's suspense days. Corrected claims will have to be sent. Duplicate payments happen when a provider rebills claims based on non-payment from the initial bill submission. Providers should not just rebill when claims are not paid, and most payers do have edits to avoid paying duplicate claims. If accuracy is not focused on when creating estimates, then credit balances will occur, and usually unhappy patients. Until real-time adjudication occurs, this will happen when benefits are checked and then a claim hits against it before yours. This does happen when COB is not coordinated correctly or if the secondary is not aware of the other coverage, which is typically rare. When is a claim rejected? And the answer here is number 2. So the first thing a health plan does when processing a claim is to check to see whether the patient is covered. They're going to look at the claim data to ensure the date of service is within the dates and all data on the claim matches what is on file, like name and date of birth. Edits will be in your clearinghouse typically. Other 2 are denials after the sum is adjudicated. Make sure you understand the difference between rejections versus denials. What is the mission of the RACs? So it's number 3, protect Medicare from fraudulent and abusive billing. What does waiver of liability refer to? And it's number 2, a provision established by Medicare to protect beneficiaries and physicians from liability when services are denied. If the Medicare beneficiary had knowledge or should have had knowledge that they were not covered, they can be billed. If neither the patient or provider knew or reasonably could have been expected to know, Medicare is liable to pay the claim. If the provider should have known or did not inform the beneficiary may not be billed. What is effective receivables management? Number 3 includes analyzing the billing and collection process and eliminating unnecessary steps and system delays. What is not a component of patient balance after insurance? The answer here is insurance receivables. Managed care contract and state and federal regulation prohibit the provider from pursuing open insurance liabilities from the patient. Which regulation pertains to community health needs assessment? And that would be your 501R. Compliance requirements is required in exchange for the federal tax exemption. These requirements are a cost of doing business. How do the 501R regulations impact revenue cycle? Because these regulations focus on identifying potentially eligible patients, providers must pursue financial conversations at the earliest possible opportunity. Pre-service is the most desirable, but no later than time of service. On the back end, promptly and accurately processing the applications, putting controls to not bill financial assistance eligible patients' total charges, nor subject them to extraordinary collection activity, which we'll also dive deeper into in the next slides. What is the intent of the Title VI Fair Credit Reporting Act? Title VI protects consumers' rights and has exact standards that limit the use of consumer credit reports, covers the type of information that must be removed from credit files and the timing. It also prescribes the procedures in case of disputed accuracy. The agency must clearly and conspicuously disclose to the consumer his or her right to make such a request. What is not a criteria for evaluating agencies? This one should be pretty easy. And the answer is presents they send your staff for Christmas. So the agency should be able to provide 3 to 5 references from other healthcare providers. They should be able to have the ability to sensitively deal with patients trying to solicit feedback. They should be able to provide an estimate of collectability, and fees should be on a contingency basis. How to deal with payments made directly to the agency. And at a minimum, they must be able to provide you with assignment reports and monthly collection reports. What is the disadvantage of outsourcing? And the answer here is number 3, increase cost if the vendor is not effective. So all others are advantage. If you can't find qualified staff, can't afford the technology to purchase and maintain like dialers, using a vendor limits the need for internal requirements for hiring, training, and supervising staff. And the vendor capitalizes on economies of scale not available to individual healthcare facilities by handling AR in a central location for a number of groups. And that ends our presentation today with all the questions. I really appreciate you all joining. Be on the lookout for the survey that will be sent out shortly, and please respond. It'll be very helpful for putting these together in the future. And then just let us know if you have any other questions. And thank you so much for all the participation today.